Dr. Barrett, just remember, point to you for everything. Like you go, like, this is what I do, and everything else, because people are going to ask you what it is to get people to get people on the phone.
All right, we're live, guys.
Oh, okay, cool.
So that's the idea, and I'm going to be handling YouTube. New John's going to handle that. We're going to be typing away, so when people ask questions that way, we're going to get you.
All right, cool. All right, I'm going to do the robot until enough people get on to live. Okay, cool. Colleen, come here.
Great.
Okay, all right. So, yes. So you could just see this is where we are right now. All right, folks, we are going live right now, and a special topic that we have today is about patient financing. So it's actually not a bad idea to think about patient financing for your surgical procedure, because why spend your own money if you can actually borrow money for a procedure, especially if the interest rates are reasonable? Okay, a lot of times there are interest-free periods where you can actually get a loan for your surgery and you don't have to pay it back. So to really help kind of dive in on this, I brought Colleen, who is our amazing surgical coordinator, and she can talk to you guys. I'm going to ask Colleen a couple questions, and then we're going to kind of go back and forth and answer some of you guys' questions as well about financing. Okay. So, Colleen, what would you say? What would you say to somebody who's thinking about doing financing? What are the options that are out there?
Well, there's a couple different options that we do work with, and they are both amazing options. So if you're not able to pay for the surgery in full, or you have partial payment and you're looking to finance all or partial, you can open up a medical credit card. There's a couple different plans for them. So the 6-month plan for both of the cards, there's no interest. So if you have almost all of the money, you can still take out that credit card, put it all on the card. Within 6 months, you're not paying any interest. Both cards also have a 24 and a 36-month plan, and both of those have fixed interest rates of about 15% or so. And even with those, if you pay it off early, there's no penalty.
That's pretty phenomenal. So you could get basically a 6-month loan for free if you pay it off within 6 months.
Yes.
Okay, so the form with that is so I guess it's a credit card. You open a credit card, and this is what you take out, and then you pay us with the credit card. Now we have to pay. I think we have to pay a percentage of our fees to us, right? Or how does it work?
Yeah. So so what you're paying, you're paying for the surgery itself. Any additional fees, we take care of for you.
Okay. Exactly. So that's amazing. Now, are there any other options for financing?
Yes. So, you can always put it on a credit card. We're starting to work with a new loan company, so we're getting that in the works right now. For that one, you wouldn't need to pay any additional fees at all. Or actually, there is an additional fee. I apologize. But it works in the same way, and that's just a loan company instead. Okay.
So if someone's thinking about getting breast augmentation, I can't quite afford it. If I could, maybe I'd have it done in 6 months. I might be able to pay this off, or if not, if they just want to finance it, is there a way that they can actually look to see if they pre-qualify for credit?
Yeah, absolutely.
Okay.
So if you're not sure if your credit is good enough to actually take out a credit card for both of the cards, you can pre-qualify. So that's a great way. It's not going to ding your credit, and you can still have a good idea whether you're going to get approved or not. Okay, so I think it's on our website. So if you guys go to drdanielbarrett.com, you go to, I'm not quite sure, is it under financing? It's under financing. Okay, so look for financing under drdanielbarrett.com, and then there are a couple different options there. I think we have Care Credit, right? What are some of the other options? And Alpheon are the two main ones we work with, but we do also work with Prosper.
Okay, Care Credit, Alpheon, we also work with Prosper. So those are some options. We're also trying to work with Lending USA, as well as a fourth option, you guys. So if you can't afford to have plastic surgery, don't get it. It's not life-threatening. But if this is something that makes it kind of more easy for you, something that you can actually get on a tighter time schedule, then by all means, let's do it. Or if you just want free money for 6 months, then totally do it. And so you can check that out on my website, drdanielbarrett.com. It's under financing. And then, of course, if you guys have any questions, you could always fill out a virtual consultation where you can submit your information, and then I have some questions about financing, and then we can, or pricing, and then we can kind of get back to you. So any questions you guys have about financing? Let's pull through here and see if we have any questions here. While we have Colleen here. Colleen, you said the interest rate is about 15%, is that correct? Mm-hmm. Okay, so that's not one you want to keep on forever. But if you want to feel good about your body, life is short. And then, let's see, depending on your height, you may want to be normal BMI. Okay, we can use our own credit card as well, correct? Like paying with Visa, MasterCard. Yes, absolutely. I believe you can, right? Absolutely. So just you got to check your limit. Sometimes if your bank, if you haven't used a card in a while, you may want to call your bank and be like, hey, I have a big purchase coming up with Barrett Plastic Surgery to get my body back, or whatever it is. That way they can anticipate that payment coming up. What are some things? What are some other pointers for people to follow before they come in for their consultation or for coming in to pay for surgery?
Well, another thing people don't really know until they actually try and pay for their surgery is they actually have a credit limit.
Yeah.
So a lot of people have like a $3,000 credit limit or $4,000, and they're trying to pay, $20,000, $30,000 or whatever their procedure is, and their bank kind of stops it. So that's another good reason too. You can just call ahead to your bank, let them know you are making the purchase, and they can always up the credit limit for about 24 hours, and then they'll put it back to where it was after.
Cool.
So we have a lot of patients that do that.
Great. That's amazing. And if people have a credit freeze, have you had anybody that has a credit freeze at all?
To be honest, no.
Oh, okay. So if you have a credit freeze, okay. So one thing, if you have a credit freeze, so like if you put a freeze on your credit, make sure that you release your freeze before you could try to go apply for a credit card or for financing for your surgery. Okay. That if you want to know what a credit freeze is, it's you go to TransUnion or you can go to Equifax and actually freeze your credit so nobody can do a credit inquiry onto you and like take out a credit card on your name, right? So someone tried to do that to my wife and try to open up a credit card on her name, and so now we have credit freezes on our credit. So that's something that you may want to look into to just protect your credit in general.
Can you tell everybody where we're located?
Yeah, you guys, so in case you're wondering, this is Beverly Hills. We are located in Beverly Hills, and Colleen's one of our surgical coordinators. She is our expert when it comes to financing. You guys, if you have questions about financing, what procedure costs are going to be, what the options are, you guys check out virtual consultation page at drdanielbarrett.com and fill out the form there, and we'll take it from there. And Colleen is here to help you as well as myself. Okay, guys?
We're happy to help.
All right. Thank you, Colleen.
Cool. No problem. We'll see you guys soon.
Okay. All right, good. So we're gonna answer some of your other questions now. Thank you, Colleen.
No problem.
And I feel like that was a big infomercial, but it wasn't. Thanks, Colleen. That was great.
Do a lot of people travel to get surgery with you?
Do a lot of people travel? Yes, actually, we get a lot of people. We're in Beverly Hills, you guys. We have LAX Airport, we have Burbank Airport, which is my favorite. Give me a shout out, what your favorite airport is. I want to know that. I'm a big believer in like going. Oh, Jet Suite's really nice too, by the way. If you ever done Jet Suite, we have a lot of people that come from out of town. A lot of people from out of the country that come here to get surgery, especially breast surgery, where you can just 5 days, boom, you get your breast done, boom, you go back home. Especially if you live in a place that doesn't have a good plastic surgeon, it can be scary. This is what we do every day. Just did surgery today. We're gonna do your surgery. Okay, great. So, what is my specialty? I'm a board certified plastic surgeon. I do face, noses. I do neck lifts. I do breast augmentations. I do breast lifts. I do breast reductions. I do tummy tucks, I do liposuction, I do thigh lifts, I do massive weight loss. I do everything, head to toe, okay? I even do autoplasty surgery, so you can bring your ears back if you want, okay? Burbank is my favorite. Yes, Burbank is my favorite. What about men pec implants? Have you done those? Yes, I have. They're tougher. They're tougher to do, okay? Because you need a bigger incision over here, okay? Men's chest, if you have your shirt off, you don't want to have big scars here, okay? And those implants are not, you can't put those in a funnel. Like a regular breast implant like this can kind of be squeezed and contorted and can go into a funnel. A pec implant is a solid form, and it takes a bigger incision to get into place. But they do look good. And yes, I'm in LA. Fucking coldest. Yes. Do you do belly button revisions after previous tummy tuck? You know what's funny? The new Amanda Lee? I do. It's one of my specialties is umbilicoplasty revisions. For whatever reason, I rank #1 on Google for belly button revisions, probably because I do a lot of them and I specialize in that. It's not cheap though, because a lot of times it requires a whole tech revision. So if you fill out a virtual consultation and send us some pictures in there, we can kind of see if we can help you out. Okay, I'm not American, but I love that you share so much and learn a lot during your lives. Dine, why not? Thank you. Thank you very much. If you're not American, what are you? Are you Canadian? Mexican? Let me know. What is the average cost of tummy tuck and breast lift? Tummy tuck and breast lift, it's a good question. It's probably here in my office. We're in Beverly Hills, so it's probably around $25,000 to $35,000. But there are other less expensive options for you. Do you help out with stretch marks that harsh cream cause, please? Hair tube, Teray, yes, I do stretch mark reversal. I do a combination of laser and microneedling. Sometimes we can actually cut it out with surgical excision if we need to. But again, check out my website, Dr. Daniel Barrett, virtual consultations. We'll get back to you. For those of you on my TikTok, also, I get back to you a lot more on my Instagram. So check out my Instagram. It's Dr. Daniel Barrett on Instagram. And you can DM me. I get back to people all the time on DMs. So I'll be up late at night and I'll be like texting my social media people. I'll be like, this is not a good post. This is not a good post. And it's like right before I go to bed. And then I get back to some of your DMs. So thank you. You guys give me a lot of positive feedback on my DMs and I really appreciate that. It's fantastic. You have the best C and D. I really love you. Thank you for all you do. You have the best C and D. What does that mean? I don't know. Well, thank you. Hopefully that's a good thing. How do you ensure hazardous waste is being disposed of properly? That's a great question. We have these big red medical bins that we put medical waste in, sharps, things that could be potentially damaging, and we have a special company that takes it, picks it up, and puts it in a truck, and then they take it and they incinerate it. So for a little while, we were actually sending off abdominal tissue with patient permission to do diabetes testing on the tissues, which is pretty cool. That was in conjunction with UCLA, so that was kind of a positive use of that. We don't make coin purses or anything out of the skin or any soaps or anything like that. We incinerate it. Okay. Have you guys remember that from Fight Club? They would like break in and get the fat out and make soap. That was kind of crazy. But I don't know, maybe it was good soap, who knows. Maybe we give you your own soap after your tummy tuck and your liposuction, and then you're like, this is my soap, I'm gonna give it to you as a special gift for Christmas. I worked really hard for all this fat. No, I'm just kidding. All right, can you talk about lip filler? Sure, I do a lot of, yes, you could save a lot by bundling surgery. Somebody just asked that question, Darlie, because the first hour of OR anesthesia is the most expensive. I do a lot of lip injections. Natural Looking Lips is my website, naturallookinglips.com. You can check that out. I'm a really big believer in not overdoing lips. You come see me, you're just gonna get a little bit of filler. Just gonna get a little bit of filler. You're not gonna get a lot of filler, just a little bit of filler. All right, because that overdone look looks worse than if you did nothing at all. Fight Club, yes. Okay, we got a couple questions. Based on your experience, have you had patients get gynecomastia covered by insurance? Also, what is the average cost of gynecomastia for someone who has male gynecomastia? So that's a good question. I've actually had gynecomastia myself. And when I was younger, I went to a general surgeon at Kaiser in Virginia, and they made a big cut here. So that always kind of bothered me because there's this big scar on my chest, and it was like a shark bite there, and lost a lot of sensation and everything else. And so that was super annoying, but it did the job. But later on, when I became a plastic surgeon, I was like, you know what, this is a procedure done by plastic surgeons. There's actually a better way to do it. So I actually created a endoscopic way to do gynecomastia surgery. So if you're thinking about it, for gynecomastia men, if you have male chest growth, come see me. I specialize in this. No one else is doing what I'm doing, at least here. So maybe one other person in Texas that's doing it. But I use an endoscopic approach to remove the glandular tissue without a big scar on your chest, right? Because remember, scars on men's chests can be much more noticeable because you wear your shirt. You don't wear a shirt, okay? So, or if you know, it can be that way for women too. So we always want to reduce scarring. The cost of that is anywhere from $8,000 to $15,000 for that gynecomastia surgery. And yes, some insurance does cover it depending on how bad it is. So if you want to submit a request on a virtual consultation to see if that works, you can send that in. Send in a copy of your insurance information, front and back, and your date of birth, and we can maybe run your benefits and see if your insurance company will help with that. A lot of times they like to send you in network, so it just depends on your insurance, okay? Let's see. Yes, it can be covered by insurance. Meg Alman, what is your question about nose jobs? I've never had one, but do I need one? I don't know. Let's see, any other questions that we got, you guys? We got here. Do I make good money? LA Boob 12. Yeah, I think I do. I saved up enough to get a Cannondale bike to ride to work every day, so I'm pretty happy about it. I'm a pretty frugal person. A lot of my money actually goes back into the practice because we are growing, we're expanding. And we're trying to do a lot of really cool things that we're really excited about. So, but yeah, there is, that's cool. Someone give me a hat. Yeah, so what else we got? Can you talk, we talked about lip filler. How much can I save with bundling filler? It just depends on what kind of surgeries you're thinking about doing. Like if you're doing a breast augmentation and a tummy tuck, yes, you'll probably save a few $1,000s by putting them together. These questions move so fast, I don't know if mine was seen, but I can watch a procedure from start to finish, seeing how a ST scrub tech sets up. I start clinicals in September, I'm nervous. Mel Renee, why don't you just come out here and check it out in the OR yourself if you want, and I can show you how our scrub techs set up. We actually have students that come and work with us for a number of things, nursing, but mainly we have a lot of scrub tech students that come out and they learn like all the instruments and how to set up and everything else. But the actual video, maybe that'd be a good training video that we could do and we could put out there. How to set up for breast augmentation. Zach, write that down. We got a video. Yeah, so it's just like, we'll put it out on YouTube and be like, Hi, I'm Dr. Barrett. This is how we set up a breast augmentation tray, and then I'm just going to hand it off to my amazing scrub techs because they're awesome. What weight and age should you be before having a mommy makeover? Totally depends, Sandra. I mean, like, whatever, however, I mean, if you're done having kids, let's do it, right? You want to kind of be healthy. You want to try to keep your BMI within a good range. If you have some weight to lose, it's all about your goal weight. Like if you get down to your goal weight, great. If you can't, and you got a lot of extra skin, like, okay, we can do the surgery, but if you lose weight afterwards, you're going to need a little touch up. Okay, so it just depends. Dr. B, I appreciate you. And let's see. Oh, sorry. What was the lip filler website? It's naturallookinglips.com. Is the lip filler. Can you use some help with online marketing, getting more clients? Probably always. My whole marketing team's in here. So they, Michelangelo at 909, I'm always open to great opportunities. When is my availability? You guys, we actually have some consult availability. We opened up 2 dates, Monday and Tuesday of next week. That's going to be it for most of the summer. So if you're interested in getting consultation, shoot us a virtual consultation at drdanielbarrett.com. We open up some extra spots. I don't know if we'll have much more if you're thinking about getting a procedure in the summer, okay? If you're looking for the fall, we can probably get you scheduled as well. But if you're looking for some time, getting this done right now, give us a call, 310-598-2648, 310-598-2648. If you're trying to get it done in the summer, we have only 2 days left for consultations to see me. We have another associate here named Dr. Yamin. He is amazing as well. He can also see you as well. Hablas español, Hector? Sí, un poquito, okay? But we do have people that speak Spanish, okay? Esmeralda is our person who speaks Spanish, more fluent than I do. Is there a risk to autoimmune disease with PEC implants? Yes, there is. There's always a risk for autoimmune disease with any kind of implants. That's why you want to make sure the implant goes in clean. Because if it doesn't go in clean, whether it's a PEC implant or a breast implant, you can get a biofilm that forms on it. And it's not the implant that causes autoimmune reaction. It's a biofilm or bacteria that constantly is triggering inflammation in your body that can cause an immune reaction. So that's why you have to go to a good, meticulous surgeon, okay? Because even in my hands, when I'm doing all these 14 different things to prevent contamination, I still get it. So imagine if you go to somebody who's sloppy and is not using Keller funnels, not changing gloves, not doing irrigation, all that stuff, not providing antibiotics at the time of surgery. Those are all things that increase your risk for capsular contracture and also autoimmune reactions because you can get that bacterial biofilm. All right, can I make a nose shorter? Yes, I can. How short do you want to do it? I've done Motiva HP implant, not under muscle. It's been 7 months and I feel it drops a lot. Yeah, I would have probably gone underneath the muscle. I don't know why you went above the muscle. It's not my favorite, but hopefully it stops. Fiance, currently 32B, want to go up a cup or two, want to look natural, not too much. It's okay, come see me. I just did a really natural breast augmentation today. Couldn't show it on social media, but we did 250 cc's, which is like really small, and we matched it with a 275 on the other side because that side was a little bit smaller. Looked beautiful, looked perfect. I do Brazilian bees all the time. So let's see what else we got. I'm giving some Instagram some love. They haven't asked me any questions. Okay, what are some recommended must-haves for tummy tucks, arm lifts, chin lipo at home for a smooth recovery? Jennifer V. Poole, glad you asked because I really have focused a lot in the past few years about recovery and optimization for any surgical procedure for my patients. Okay, so I actually developed a whole website. It's called postoprecovery.com, where I have a lot of products. So, things like Leaky Gut Guardian to help your gut recover after, the stress of a surgical procedure and the antibiotics. I have magnesium to help relax your muscles after breast augmentation. A lot of people think, oh, I have to take pain medication because my breasts hurt. Well, it's not really your breast hurting, it's your muscles that are spasming and it's tightening. So if you actually take magnesium, it's not a big deal and it actually relaxes and you sleep better and you get your bowel functions look better. CBD is another thing that I recommend for any post-operative procedure. I don't recommend narcotics. I do prescribe them, but they're there as kind of like nothing else works. So I recommend my patients take my CBD, which is 1,500 milligrams, super strong, organic. We had it independently tested by a third party. And it turned out to be clean as a whistle, no pesticides in it whatsoever. It also helps with sleep, helps prevent anxiety. It's one of my favorite things. We also use some products. I'll show you guys everything from digestive enzymes. Probably don't understand the link there, but you can listen to my podcast about it. Magnesium, this is the one I talk about. And then there's fish oil, right? Fish oil helps prevent capsular contracture by 10%. The product I recommend, it's not mine, but I take this one every day. It's called Living Fuel Super Essentials Omegas, okay? And I don't really make any money on this. It's on my website, postoprecovery.com, if you want to check it out. But if you're getting breast augmentation, a study has shown that if you take fish oil afterwards, your capsular contracture rate goes down by 10%. So why wouldn't you take fish oil? Fish oil is great for longevity too. It's great for inflammation after a big hard workout, or if you have sore joints. Instead of taking ibuprofen, take a little fish oil. My little secret I learned from Ben Greenfield. He talks about it on his podcast. Okay, digestive enzymes. Let me tell you briefly about this, why this works, and why our Leaky Gut Guardian works as well. Your gut, of course, when the phone started ringing during the time, how it's better to work out to try to get tone before having my makeover. So, yes, it's definitely good to get tone and muscular strength before a mommy makeover. Okay, get as much as you can. That's my recommendation. If you have all the time in the world, go for it. Get to the best goal weight and fitness you can be before having surgery. But, you know, if you really want this sooner rather than later, then go for it. You know, I get people that hop in, you know, before they reach their goal weight, and they're really, really happy that they did. Let's see. How does financing work at your office? Willing to travel from Jersey? Yeah, well, fill out a virtual consultation form. We have a whole section called financing. You can actually see if you qualify ahead of time before you come in for the procedure by checking out the website. And then also, if you want to find out more information about how much your surgery might cost, you can just fill out a virtual consultation website at drdanielbarrett.com. I did promise you to guys talk about the digestive enzymes. The reason why this works is a little bit complicated, so bear with me. Okay, so in our body has antibodies that attack foreign things. When you eat food and your gut is normal, all the food stays within your gut lining, okay? If you start to break down the food particles into tiny little food particles and then they get absorbed into their basic subunits, that's the normal scenario. But if you had a lot of stress in your life, if you had a lot of leaky gut, or if you had a lot of antibiotics and you don't have good gut, healthy biome, your gut becomes leaky. Or if you take a lot of Advil or aspirin every day, you will lose those tight junctions in your cell wall, right? So instead of them being tight, they start to get loose, and now all of a sudden, bigger proteins get into your bloodstream. So imagine you have a peanut goes into your bloodstream, or peanut goes into your gut, it gets broken down, but then some big peanut proteins get into your bloodstream, all right? So the reason why you want to do digestive enzymes is because it breaks down those peanut proteins even better so that they don't go into your bloodstream as a big peanut protein. Now, why is that bad? You know, peanut protein triggers an immune response in your body, so you feel like shit. So that's why it's like some foods you might eat, like eggs, or, you know, you might start to have a lot of food sensitivities all of a sudden. You know, when I did a test, I had about 20 food sensitivities, very severe. I had horrible leaky gut. I grew up in Virginia eating hot dogs and soda and Oreo cookies and all these different preservatives. We didn't know anything about, you know, proper food eating and stuff like that. And I also started getting some lupus antibodies. So why is that a problem? Well, antibodies develop in your bloodstream to the peanut protein, but guess what? That peanut protein also looks a lot like your thyroid, okay? So now all of a sudden you got Hashimoto's thyroiditis, or it also looks like a skin cell. So now all of a sudden you have psoriasis, or it also looks like a large intestine cell. So now all of a sudden you have ulcerative colitis or Crohn's disease, all right? And it all starts because your gut is not doing a good job protecting your bloodstream from all the food particles that you're eating. So one of the best things you can do for your health and longevity is to take digestive enzymes every single day. And then also there's a healthy biome product. I'm actually going to be on the podcast of the guy, Wade Lightheart, tomorrow to talk about how that's actually improved my patient's life. I had a patient with rheumatoid arthritis. She started taking the digestive enzymes and Leaky Gut Guardian, and her rheumatoid arthritis went away. She's like, "Doc, thanks for the boobs. They look great, but my rheumatoid is gone." All right, so we healed her gut, and I do that as a routine for people coming to get implants, especially because I'm not trying to upregulate their immune system by doing their surgery. All right, so I bring in some of these other, and I'm a classically Western trained doctor, right? But these are some newer things that we all kind of need to start thinking about, and nobody's teaching us. The food companies are not teaching us any of this stuff when they're loading you up full of all those preservatives, okay? So that gut biome, I think it's called, do you guys want to grab that product? That's the other one. It has 3 things in it. It has probiotic in it, prebiotic, and then IgY Max, and that was kind of the secret ingredient. So I did those 3 things. I did digestive enzymes, got a lot of improvement, bloating, stuff like that stopped. And then I did the gut biome with the IgY Max. It's called the Biome Breakthrough by BioOptimizers, also on my website, but you can get it on Amazon. And then I did fasting. I also started fasting, and fasting is great for your health, your wellness, and everything else. So sorry, that was a long explanation, but it took me that much time to really figure out what the hell was going wrong with me and a lot of my patients and a lot of people with autoimmune. It's like, you know, you go to your doctor because your thyroid's not working. What do? They prescribe you thyroid, the thyroid output, but no one's ever asking why the hell your thyroid is that happening. Same thing with diabetics. Why is my insulin not being, you know, effective in my bloodstream to clear my blood sugar? Or why is my pancreas shutting down? Nobody really asks about that, right? So you really need to kind of get to the root cause of why these things are happening, you know. All right, guys, so we'll answer a couple more questions and we got to sign off here.
How long after surgery can you wear a sports bra?
So I'm a little bit different when it comes to breast augmentation protocols, all right? I don't recommend you wear any kind of bra for first 2 weeks. Okay, digestive enzymes are not the same as probiotics. Digestive enzymes help break down your food. Masszymes is a product I recommend, okay? Masszymes. It's on my website, postoprecovery.com. So I recommend that my patients don't wear any kind of bra right after breast augmentation. The reason why is I would listen to your doctor, whatever they suggest, do that. But if you're my patient, when I do breast augmentation, I don't recommend it because think about it. We just squeezed in an implant here. It's already tight. Now we want to put a bra on, it's going to compress it, it's going to decrease the blood flow there, okay? If you want to observe in the operating room, shoot us an email, careers@Barrett Plastic Surgery. If you're interested in a job, careers@Barrett Plastic Surgery, let us know what you're good at, okay? Anyway, implant goes in. If you put pressure on the outside, you're going to decrease the blood flow. What do you need to heal? Blood flow, okay? So that's why I don't do surgical bras. For the majority of my patients, I do it in certain situations where I have fold issues or things like that I want to kind of reinforce. The link for virtual consultation, go to drdanielbarrett.com and then click on virtual consultation. I think that's how we find it, right?
Yeah, or our Instagram stories.
It's also on Instagram stories and the link in the bio? Mm-hmm. Okay, cool. Great, you guys. So I'll get one last question. Looking on website now, Ellen, expect a consult from me. Okay, I'm waiting for you. Okay. And then yes, careers@Barrett Plastic Surgery, you guys, is a way to get if you're interested in coming to work here or just even kind of check it out. And then do we need a surgical tech? We're always looking. So if you're interested in being a surgical tech, shoot us your resume. Right now we have a good solid team, but you never know. We can keep your resume on file. All right, guys. Thank you for tuning into the live. You guys, you have a wonderful rest of your day. And tomorrow, I'm going to be on the BioOptimizers podcast, which you guys should check out. That is the creator of these products that I carry, on a lot of the products that I carry on my website, and some of the products that have actually kind of healed my gut and many of my patients' gut. So we'll have more information about that. And don't forget to follow me on Instagram. I've got more stuff on there, and I get back to you guys in my DMs. So Dr. Daniel Barrett on Instagram. And if you're on my Instagram, check out my TikTok. Okay, Barrett Plastic Surgery is my TikTok. You guys, if you're not on TikTok yet, get on there. We got some fun stuff on there as well. Thanks for watching.